expected because there was a lot of scar tissue from last time.
Mm-hmm.
But he said the bowel looked good. He didn't see anything unusual. No blood loss.
Hmm.
Didn't have to give him any blood.
Great.
No sign of any additional leakage. Of course, we would have known that. He said the pain should be manageable. It's surgery on his gut, so there'll be some pain. But he said that the nerve block and the narcotics should all take care of that.
Mm-hmm.
He said he definitely is not going to be coming home Saturday.
Okay.
He said, "What is it, 4 days?" And I said, "Yes." He said, "Oh no, he's not going to be coming home Saturday." He said it might be that long before he passes gas and they remove the NG tube.
Oh, I didn't realize that, but I thought that sounded awfully fast, but nobody questioned it.
Right. So I said, "Listen," I said, "that is not a problem whatsoever."
Mm-hmm.
So I'm just asking because we didn't know how long, so we just picked a day. But I said, "That's not a problem." He said,
Well, that was based on they said he'd be in the hospital 3 or 4 days and go home. I don't know who said that, but that was said.
"That's right." He said that he'll be on TPN, but he'd be weaning off of it. That this surgery puts everything back in operation. The bowel will be absorbing hydration
Mm-hmm.
and slowing down the small intestine
Mm-hmm.
so it can do its work. And he used the term adapting.
Mm-hmm.
He said his intestine. He said that Lala just sent me a message. I just talked to her.
Mm-hmm.
He said it'll be adapting and it'll take a few months for it to adapt. But he said he will be coming off TPN in a few weeks.
Mm-hmm.
And I said, he's under the care of a nutritionist in Birmingham. Is it more important that he have a GI doctor or a nutritionist? And he said a nutritionist.
Yeah, good.
Yeah, he said that's what he needs, a nutritionist.
And
I said, well,
what is the doctor's name?
What doctor?
The surgeon.
Chowdhury.
It is, okay.
Yes, Mohammed Chowdhury.
Okay, that's what I thought, but that's not what... Okay, that's fine. Go ahead.
And he is one of Dr. Bartlett's doctors. He's on Bartlett's team.
Right.
He said Dr. Hogue has rolled off to a different assignment.
Oh, okay.
And I asked about Golis. I said, "Have you talked to Dr. Golis?" And he laughed and said, "No, I haven't, but I'm sure he's doing fine." I said, he seemed to be the one that we saw the most, and we always felt very reassured with him.
Mm-hmm.
I said, "But," I said, let me tell you what happened after he left here last time. And I explained that all to him. And I said, looking back on it, we feel like he should have left with TPN and fluids because he got in trouble very quickly. And he said, "Yeah," he said, "I think you're right." He said, "We do make mistakes and we overlook some things from time to time, but we have patients that are doing fine here with an ostomy, and then they get home and just everything picks up speed." But he said it does sound like he should have gone on with that. So I said, we're not trying to wean him off anything right now, but we just want to know what the future holds. He said, "Well, the future is good. The future is good." He said he will be adapting to this and returning to normal. So now he'll have bouts of diarrhea, but that can all be managed.
Yeah, I've heard that before.
Yeah. So, let's see what else I've got in my notes here. He had nothing by mouth until he passes gas, which could be 2 days, could be 4 days. And when he does, then they'll remove the NG tube and start giving him a little liquids. And then after a day or so, full liquid diet, and then after that, soft foods.
Mm-hmm.
But it sounds like he might be up here for 2 weeks.
No.
Sounds like it to me. Could be.
If that's what it takes.
Let's think just a minute.
If that's what.
Maybe not, because today is Tuesday. I wouldn't expect he'll be coming home before probably at least a week from today.
Well, that sounds a little better. I mean, I can understand it. I mean, we all thought that 3 to 4 days didn't sound like enough, but nobody indicated anything that long.
Let's say let's say in about a week. I'm gonna predict a week from today.
Okay.
Okay. So that's not 2 weeks. That's more like 10 days.
Well, hopefully in the next day or so they'll be able to clarify that and see
Mm-hmm.
with more certainty or probability.
Yeah. So call Grandma, let her know,
Okay.
and when I get back to the family house, I'm going to put out a outpost.
Yes, please do.
I will. Okay.
Okay.
How are you doing?
I'd actually gone back to sleep. I was awake when everything started,
Mm-hmm.
and then I got the anxiety, so I took half a Xanax, and apparently that was enough to let me.
Mm-hmm.
Yeah, I went back to sleep.
Good. Okay. Well, it's gonna be another hour or so before I can see him.
But he is out of surgery.
Oh yes, he's in recovery, and he's not going to be going to SICU. He is going to Fort Maine.
Oh, really? Okay, that's
Dr.
good.
Bartlett will be back this weekend, and he'll come see.
Okay.
But he said and he'll be under Dr. Chaudhry's care. And he said if you're not seeing me, that means I'm not concerned about things, and things are going okay.
Mhm.
He said if I get concerned, you'll know it.
Mhm.
So, but of course, I'll be there every step of the way, so I'll know
Mhm.
if anything's going on too.
But do not expect him in ICU, in recovery, and then out to the floor.
That's right. Going
Okay.
straight to the floor.
Okay. And well, one of the things that Brian Maloney had mentioned is that the doctors, or his wife did, that they said that they looked, and everything, and that they didn't see any signs of recurrence or anything, nothing visible,
Mm-hmm.
anything
Yeah,
meant.
and Dr. Chaudhry said the same thing.
Okay, good,
He said, no,
excellent.
everything looked fine. He said, just a lot of scar tissue.
And is that common, or did you ask?
Well, it's common for the magnitude of what they had to do the last time.
Mm-hmm.
And it just slowed things down. It's like they found more tumor than they, had hoped they would find. And in this case, he found more scar tissue, but he said the patch, asked him if he saw the patch that Dr. Zay had made. He said no, but he wasn't looking for it, but he saw no indication of any leakage or any further problems down there.
Mm-hmm.
It all looked fine.
Mm-hmm. So how long did the actual surgery take?
About, let me think, he came out and saw me at 9:30, and he was dressed, and he was out of his garb, so about an hour and a half.
Okay, so they didn't start at 7:30?
Well, they took him back at 7:15, so
Okay.
yeah, I'd say probably from 7:40 to maybe about 9:10,
Right.
like that.
And theoretically, I guess they could have still been closing him up, or were they?
Mhm.
Okay.
Yeah, and he let the drain in.
Yeah.
Because these.
But it was
will
laparoscopic.
heal.
There's no new big incision of any kind. There's
No,
Did
no incision.
any mention about that spot that still hadn't healed well?
Mm-hmm.
Okay.
No, they looked at it this morning,
Okay.
but no mention of it.
Okay. Okay, good. Well, I know that they can watch that, and if it were to need the wound vac, they could do that. So I know he's where they'll know what to do with that.
Mm-hmm. They sure will.
Okay.
So we're back under good care.
Okay. All right. Sounds good, Wayne.
Okay.
So
let Mother know.
Okay.
I'll put something out.
Okay, great.
I'll talk to you later today.
Yes, please.
I'll call you.
Love you.
I love you too.
Bye-bye.